Hello and welcome back. I just wanted to provide a short video demonstrating the intricacies of our RAS system. This RAS system is known as the Renin-Angiotensin-Aldosterone System, and it plays a crucial role in regulating our blood pressure. And let's see how it's connected. We have to first acknowledge the importance of our kidneys in the RAS system. And our kidneys are going to help remove waste and excess substances from the blood, keeping our blood in balance at an equilibrium. And one of the most critical substances that our kidneys helps to regulate is the electrolyte sodium. The RAS system cannot operate all by itself. It's not a system that can act independently. There are many moving parts and contributors, and it only comes into play when your body senses a drop in blood pressure or volume. Now, think of RAS being um, a operation of hormones and organs, and basically they all come together to provide a emergency response, so to speak, to maintain this equilibrium when your body senses or the RAS system senses that there is a decrease in pressure. Other things that could drop your blood pressure or be related to your blood pressure is dehydration and blood loss. Once your body recognizes that there has been a decrease in volume, renin will be released. The kidneys release this enzyme into the bloodstream, and it acts as an alarm or a trigger saying that we need to raise the blood pressure. Once renin is released into the bloodstream, we move into the second stage, which is the formation of angiotensin. Renin is going to be the first to set off this domino effect. It's activating a protein called angiotensinogen. When exposed to renin, angiotensinogen will transform into angiotensin 1, which is a potent blood pressure raising compound that is needed to offset the slow volume. Angiotensin 1 is a precursor, though. Another enzyme called ACE, angiotensin converting enzyme, has to also come into play. And its job is to now convert angiotensin 1 into angiotensin 2. Angiotensin 2 is what we really need. Angiotensin 2 is a potent vasoconstrictor. Vasoconstriction is what we need, that narrowing of our blood vessels, which will help to increase the blood pressure and ultimately will help us to restore equilibrium and balance. The next stage is stage 3, where aldosterone will be released. Aldosterone is only going to be released once angiotensin 2 signals the adrenal glands to release the hormone aldosterone. Remember, the adrenal glands lay right above our kidneys. So, as a review, angiotensin 2 signals adrenal glands to release the hormone aldosterone. And aldosterone's job or mission is to then fine tune the blood pressure and fine tune the kidney function as appropriate to what the body is expressing. It does this by telling the kidneys now, retain the sodium. If we retain sodium, remember water follows sodium, so we're retaining fluid. This is going to help increase our overall blood volume, which eventually is going to elevate the blood pressure. Once our blood pressure is back to normal, the RAS system will be able to sense this, and it's going to call off this response. It won't trigger renin to be released again until it senses that there's a decrease in volume or blood pressure. It's a very intricate feedback mechanism or feedback loop that's designed to ensure that our blood pressure remains within the optimal range. If you can understand how the RAS system is essential to our blood pressure and kidney function, it's going to help you to understand conditions like hypertension and heart failure and kidney disease. Also, it will help you to understand the medications that we use to inhibit or block the various components of the RAS system to aid us in equalizing or normalizing blood pressure and kidney function. So, as you continue to delve in to the importance of the renin-angiotensin-aldosterone system, I just wanted you to uh, I wanted to encourage you to try to teach this to someone else and to draw it out, to make the connection so that it can be almost second nature when you're thinking about this. If you can master the RAS or the renin-angiotensin-aldosterone system, you're going to be able to take great care of your patients. Thank you for listening.